a lot of people ask, is it safe to get pregnant if I have breast implants? And number two, can I breastfeed if I have breast implants? And the answer to those two questions is yes, but it depends. So in general, it is safe to get pregnant if you have breast implants. The implants are within a capsule underneath the breast and usually don't really affect anything to do with the pregnancy. Now, after the pregnancy, a lot of people then ask, well, are my breasts going to stay the same? And the answer is no, not really. If you are getting pregnant, pregnancy changes the breast, whether you have an implant under it or not. So that's something to keep in mind, that the breast will change after pregnancy, whether it's going to get smaller, whether it's going to get looser, whether it's going to get bigger. All of those things will happen to the breast regardless of whether there's an implant under it or not. Can I breastfeed after an implant? That's a very important question. And the answer to that is yes. But there are certain points that I think is important to mention. So if you have an implant, and implants in general tend to be placed, so this is the breast, and this is the muscle. The implant can either be placed under the muscle or above the muscle. Either way, it is underneath the breast tissue. So it should not affect. So for example, these are the ducts that make milk, and they all come together and converge to come out to the nipple. And that's how breast milk is made here, and it comes out. Now, the implant is going to be situated behind the breast glands. So it should not affect breastfeeding. The answer is yes, you can breastfeed. There are, however, two things that can affect breastfeeding when it comes to implants. Number one, if you have a very large implant that is essentially pushing the glands and pressing on the glands, that may reduce the amount of milk that's being produced. So that's number one. Number two, when we do implants, we tend to use different types of incisions. So for example, if here's a breast, one can use 3 different main types of incisions. You can make an incision underneath, around the nipple, underneath the breast, and in the armpit. Now, as you can imagine, if you're making an incision around the nipple, to get to this area, you have to go through the breast tissue, and therefore you may damage some of the ducts in the process of having a breast augmentation. So that is a point that may affect breastfeeding. So the simple answer is, in most of these things, is yes. Number one, it is safe to have implants in when you get pregnant. Number two, you can breastfeed. However, having a very large implant and possibly an incision around the areola actually may affect the amount of milk that's being produced.